fecal mass in the rectum. Always we can feel it if we do PR, but we are not doing it anymore unless it is needed. The younger infants has high risk of anatomical and organic cause, and the functional constipation remains most frequent conditions. The fidget symptoms are more relevant in the Middle East compared to the global figures. I don't know, شكلهم دلوعين هنا في البلد, I don't know, or in the Middle East in general. Or maybe the maternal depression is more, but there is some reason which needs more researches. It's anyway around 55% overall global prevalence of fidget syndrome. The human gut microbiome, a potential controller, the gut microbiota is referred as a hidden metabolic organ due to the immense impact of on the human well-being. If we are looking for the human gut microbiota, we can find that the host metabolism itself, the synthesis of short-chain fatty acids, and the micronutrients, the immunity, it regulates the gut barrier integrity, the nervous system, which influences the gut-brain communication, the energy production, which is coming by the gut-brain communication, the colonization resistance, which is against the disease-causing pathogens, and lastly, the nutrition, which is help in the digestion. Also, the incomplete lactose digestion. As we see here, the lactose formed in the diet with insufficient lactase in the small intestine make a bacterial fermentation of the lactose in the colon, which make symptoms of lactose maldigestion, overdistension, more fuzzy, more colicky pain. Incomplete protein digestion. Many young infants produce small or smaller amounts of the enzyme pepsin and of the acids that aid digestion, so may have trouble in the digesting protein. The gastrointestinal immaturity may contribute to incomplete protein digestion. As we see here, the amino acids, it's coming with the polypeptide chain and the endopeptase. Here in the brush border of the enzyme, it is attached. So if it is incomplete protein digestion, it will create more fidget syndrome and lead to this fuzzy and crying and discomfort. The application of gut dysbiosis in infantile colic, the lower microbiota diversity and stability in the first week of life, and changes in metabolites of gut microbiota. Leads to alternating in intestinal transit, spasmodic bowel movement, gas accumulation, and gut inflammation. The evidence has shown that fidget can impact the whole family's quality of life. The higher quality, as we see, observed in patients of fidgets, more missed school days, more missed work days for parents, the dissatisfaction with the daily family responsibilities, amount of leisure time and shared activities, and the crying in early infancy is related to the greater family disruption. The vicious cycle of infants crying and maternal fatigue. It is a real vicious cycle. So what will happen here? The mother cannot meet the baby needs because she give him food, she changed his diaper, she give him medication, but he's still crying. So what will happen? It is increased crying. Baby is not content. Mother cannot rest. Increased fatigue. So what this risk for? She's moving him a lot, right? Shaking baby child abuse. She'll become crazy. And postpartum depression for her because she cannot meet the need of her baby. Okay? This mother needs rest, right? So we have to find a treatment for these issues. The main contributors to total cost of illness